Breast cancer arises when cells within the breast grow too fast and out of control. The rate of growth of these cells exceeds rate of dying, eventually form a swelling or tumour within the breast. This tumour continues to grow, and if not detect and treat, it can spread to surrounding structure of the breast and armpit. Subsequently, cancerous cells may spread to distant sites like the lungs, liver, brain, and bones. Part of this tumour may need to be removed and check under microscope to know what it is, and this will help doctor to plan treatment options that is best for such group of cancer. Please see a doctor if you notice any swelling or changes in your breast. It is not completely clear why cells in the breast grow uncontrollably and become cancerous. However, certain conditions or risk factors increase chance of developing breast cancer. Being a woman increase the risk of developing breast cancer. However, breast cancer has also been seen in men, although it is very rare. Women who are older than 55 years, obese, smoke and drink alcoholic beverages are at increasing risk of developing breast cancer. Similarly, the risk of developing breast cancer is higher in those whose parents, siblings or close relatives have breast cancer. In addition, some abnormal genetic makeup, which can be passed from mother to children, raises the risk of having breast cancer. The disease is usually seen at younger age in those with these abnormal genes. In early stage of breast cancer, there is usually no symptoms and the disease is hard to detect. This emphasized the need for periodic breast self-examination and see a doctor if you notice any changes in your breast. Mammogram will also help to identify the disease at early stage. In later stage of the disease, the commonest symptom is mass in the breast or armpit. Other symptoms that may be seen include pitting or dimpling of the breast, like surface of an orange, bloody nipple discharge and breast pain. There may also be a sunken nipple and dryness and thickening of the breast or skin around the nipple. Please see your doctor if you noticed any of these symptoms. At present, breast cancer is not preventable. However, certain things can be done to reduce the risk of developing breast cancer or detect the disease at early stage when it is easier to treat with good chance of survival. To reduce the chance of developing breast cancer, certain behavioral modification needs to be put in place. This includes exercise and eating balanced diet, or in moderation to reduce the chance of obesity. It is also important to stop smoking and drinking of alcoholic beverages. Breast self-examination and looking at the breast tissue with the AID mammogram are very important in early detection of breast cancer. Breast self-examination is usually done to detect the change in size, shape, or contour of breast. You will also look for skin changes around the breast or nipple. In addition, you need to feel your breast for a mass or lump, which may feel as a pea. This is recommended to be done every month after your period or a particular day in a month for those who no longer menstruating. You will be taught how to do breast self-examination in our next video. Mammogram is a way of looking at the structure of breast with device that look like an X-ray. It detects subtle changes in the structure of breast that may not be felt. You will be subjected for further test when the mammogram is abnormal. This modality has made it possible for early detection of breast cancer with good chance of survival. This test is recommended every year for women above the age of 40. Those with higher chance of breast cancer, such as those whose any of their close family member had breast cancer, should do the test earlier than 40 years. Treatment of breast cancer depends on the stage of disease at diagnosis. The modalities of treatment include surgery, chemotherapy, and radiotherapy. Combination of these modalities may be required in majority of cases. Treatment when the disease is still confined to the breast has a good success rate with higher chances of survival than when it has spread beyond the breast. Kindly subscribe to this channel for similar videos and share it with friends and family.